So now we're going to talk about what is covered by Original Medicare. Okay, there are 4 parts of Medicare. A lot of people get confused by parts versus plans. They all have letters after them. It makes it very confusing. Here's the cardinal rule that you should always go by. Parts. Those are what you've been working for your whole entire life and are what you're entitled to from the federal government. Plans, those are offered by private companies like a Plan G Medicare supplement. That's a secondary plan that you would get in addition to Medicare. But the parts of Medicare are what you're entitled to, and there's 4 parts. Okay, you have Medicare Part A, which is going to cover hospitalization. It's going to cover inpatient room and board, skilled nursing, home health care, and hospice. Okay, Medicare Part B, which is the medical portion of Medicare. Okay, that's going to cover doctor visits, inpatient, outpatient surgeries, preventative care, ambulance, emergency care, imaging, lab work, DME, which stands for durable medical equipment. Do you need a walker? Do you need a wheelchair? Do you need a sleep apnea machine? All of those would be covered by Medicare Part B. Now, Medicare Part B will also cover a limited amount of medications. Okay, Part B will cover chemotherapy medications, which are very expensive. It will cover the cost of those. It will also cover the cost of any medications that are infused in a doctor's office. There are a few conditions, rheumatoid arthritis, irritable bowel syndrome, are conditions which are treated very effectively with infusions. Those infusions are very expensive. They are administered by a doctor in the doctor's office, and Medicare Part B will cover those infusions. Okay, now when you use Medicare Part A and Part B together, it's also referred to as using Original Medicare. When you use Original Medicare, you can use any doctor, any hospital in the country that accepts Medicare. You have nationwide coverage. Okay, now we're gonna skip Medicare Part C and we're going to Medicare Part D. I think it makes it easier for me to explain Medicare Part C. Medicare Part D is prescription drug coverage. Prior to 2006, Medicare didn't cover outpatient drug costs at the pharmacy. So this was a game changer. Okay, now Medicare Part D plans are funded by the federal government, but they are administered by private plans. You can either get your Part D coverage through a standalone plan or through a Medicare Advantage plan. We're going to go a lot more into Medicare Part D towards the end of the webinar. So any questions you have on that, just hold on. We're going to answer a bunch of those towards the end of the webinar. Now we'll go back to Medicare Part C. Medicare Part C is Medicare Advantage, and it is a private plan that you enroll in that replaces Parts A, B, and D and combines them into one plan. Now, these plans are required to cover the same core benefits that Medicare covers at different levels, but they have to cover the same benefits that Original Medicare would cover. Now, Medicare Advantage can also add some of the benefits that are not covered by traditional Medicare, dental, vision, hearing. We'll get a lot more into that later on in the webinar, but that's what Part C plans can cover. Now, how Medicare Parts A, B, and D work together. I'm going to use a knee surgery example here, and I'll try and stay with this knee surgery example throughout the webinar. I think a lot of you might have been putting off a knee surgery until you go on Medicare. It's going to be covered very well, a lot better than an individual plan or a group plan. So I think it makes it easy to explain. Now, with a knee surgery, you're probably going to be hospitalized for a few days. You're going to need some follow-up treatment, prescriptions, maybe some equipment. So it's a good way to explain how Medicare is going to cover that procedure. Now, Medicare Part A would cover the cost of the hospitalization for all the days that you were hospitalized. It would also cover the skilled nursing facility if you needed to go to a rehab facility after the surgery. Medicare Part B would cover the cost of the surgeon, the anesthesiologist, any of the follow-up visits that you had with orthopedic, physical therapy. It would also cover if you needed a scooter or a walker to help you get around. It would pay for that equipment. Now, Medicare Part D would cover the cost of any of the medications that you had. Did you need an anti-inflammatory, an antibiotic, or a pain medication? Part D would cover the cost of those.